back. It's Shay. Thanks so much for tuning in for another video here on my channel. You guys already know we talk about nursing, beauty, and lifestyle. So today we're going to be toning into our nursing journey, where I talk to you guys about my 2 jobs as a registered nurse. If any of you guys are not new here, I am a registered nurse in a facility, aka a hospital, for acute care, and I also work as a home care nurse. So I want to talk to you guys about the pros, the cons, and how they compare to one another. So if you're interested, stay tuned. We'll jump right into it. So as you guys know, I am working as a home care RN, and I am also an RN in a hospital. So let's talk about these 2 jobs and the differences, pros and cons, and kind of which I like better. So first thing we're going to talk about is convenience. Convenience can work both ways with both of these jobs. So in the hospital, I love the hospital because of the 12-hour shifts, guys. I love to get my 2 or 3 shifts done a week, be done with my hours, and enjoy my 4 days off. That is what I love about the convenience of the hospital. Also, I know a lot of people talk about the shifts as well as working weekends. Here at my institution, on my floor, because we have such a large staff, I only have to work every 3rd weekend, which is very beneficial for me. I still don't like working weekends. I'd rather be with my friends and my family who are not working weekends, but of course I do have to keep in mind when most of them are at work during the week, I'm enjoying 4 days off in between. Now when it comes to home care, convenience is here or there. I do pick my own schedule because I am PRN, so that is convenient, but it also depends on locations, and it also depends on how comfortable you feel in homes. I do pediatric home care, so I do work shift work instead of going from home to home. So when I'm doing shift work, I still have to feel out a home when I first get accustomed to it. Now I know if you are a home-to-home home care nurse, you never know what you're getting into. So that is where it comes to play as far as the convenience. So just keep that in mind when you're thinking about both jobs. The second thing we're going to talk about, guys, is skills. So as a registered nurse in the hospital, my skills are always on fire. Not say I'm the best at everything I do, but I feel like every time I go to work, I'm learning something new, and there's always more to be learned. Of course, with policy changes, new interventions, and things like that, nurses are constantly being educated in the hospital on new techniques, new practices, and trying as best as we can to perfect the current practices we have. Now, when it comes to home care, I feel like if I were to just work home care and not work in the hospital, I might get rusty on some things. There's some things in the hospital that I do every single day, or I do every time I work, and I'll never get rusty because I'm always doing it. Now, if I work home care, it's case by case. So I'm not going to see everything all the time. And some stuff is going to be new, and some stuff is going to be constant and forever constant. So I don't like to say that when you're working home care, your skills are more declined, but I do like to say that you get more comfortable in the skills you know, and sometimes it's hard for you to remember bedside skills. Labs is one of them, I can say. Putting in IVs. I mean, I know a lot of home care does this as well, don't get me wrong, but I get sharper in these skills the more I do them. I learn how to get hard sticks because I have them. When you're going for home care, I mean, you will have some hard sticks and things like that, but you're not, I'm literally drawing blood or putting in an IV every time I go to work at the hospital. This has no comparison to home care. There's just tons of skills. I can do almost 10 to 20 skills a day in the hospital that are critical skills that I'll only do the same things over and over again when I'm in home care. So I do think my home care agency does do refreshers, and they do education to keep you up to date with what's new, what's hot, and also keep you doing things that you might not have done in a while. So I will say for that, they do try their best, but overall there's no comparing. Like when you work in a hospital, your skills are sharp as day. Any facility, even long-term care facilities, your skills are sharp because you're seeing this stuff more frequently, and you're also one of the institutions that's most up to date because you're doing acute care. So we're gonna talk about a fun one. My sanity. Where is my sanity at? Oh my gosh. I don't even know if I have to tell you guys this. Home care has made me such a mellow nurse compared to the hospital. At the hospital, I can be on edge a lot of the time. Sometimes I have anxiety thinking about going to work the next day. Home care is more lax, and here's why, guys. for one, I mean, you do have, especially for pediatrics, you have parents who, you know, have children. They want to make sure their children are in good hands. You do have, like, family members watching you and things like that. But it's not to the point, like, depending on the comfortability of the home, nobody's hoovering over you, and nobody is telling you what time you have to do everything. Perfect prime example. I remember the first time I started home care, I had meds due at 9 o'clock, and I started preparing the meds at 8 o'clock, and the nurse who was orienting me was like, what are you doing? I said, I'm getting the meds ready. I was like, we got meds due at 9. I gotta have them ready so I can get them at 9 on the dot, because you know we can get busy and other things can happen. And she says, Shay, take a deep breath. You're in home care. Today you only have one patient. You can give these meds 1 hour before if you want to. You can give them on the dot because you ain't got 5 million other things to juggle with other patients. And you can even give them up to the 30 minutes after the time if you need to. So she was like, you are pushing yourself to the money. You ain't got to be doing all this. And I was like, wow, how the hospital conditioned you. Now at the hospital, if I had meds due at 9, especially like, you know, morning med past 10 a.m., I'm starting meds at 9. I'm starting at 8:30 if I got more than 5 patients, because it's just so much. So it's crazy to see how your sanity, like even the way I move, I don't have to be in a rush, hustle, bustle in the home to do everything, because it's more relaxed, it's more calm. You're also feeling out your patients. So I kind of always, especially with my kids, I go with their flow. If they're like watching TV or something, I'm not gonna be like, yo, get up, I gotta do this procedure. But in the hospital, if my patient's watching TV, I'm coming in, hey, I gotta pause this real quick, we gotta get this done. Not only to stay on top of stuff, but also because if you have so many patients, I can't let anything get back, because if it does, I don't know when I'll be able to address it again. So my sanity, guys, I'm just I feel like I'm a newborn, like, I don't know, I'm just a refreshed person when it comes to home care. I'm not worried, I don't have anxiety, I'm pretty much relaxed. Don't get me wrong, emergencies sometimes happen. Things are happening where I gotta call the office and talk to the clinical manager real quick, but it's not as crazy as my hospital mind. My hospital mind is always on 10. Okay, last but not least, guys, I know some of you guys are waiting for this portion of the video, so we're gonna talk about pay. Do I make enough at both jobs? No. Say that. But when we talk about home care versus hospital, there are a few things you have to take into consideration. One thing, home care, not that it's easier, not that, you know what, let's just keep it 100. You're gonna make less, because for one, you only have one patient. You're doing all the care for this one patient. So therefore, doing all the care for one patient is not compared to doing care for 5 or 6 patients at one time. Your work is going to be a little bit more lax because you only got this one patient, and it's not like they do have 10 million things to do. Now, don't get me wrong, you will have your trach vent patients, you will have patients that do have a lot of care involved, but the companies will make sure they compensate you depending on the cases that you have. Now, one thing I do have to recommend to people, if you are an experienced nurse going into home care, when you get into home care, make sure you let them know how much you make at the hospital, and make sure you exaggerate to them what your experience is, because most time they will, I don't want to say they'll lowball you, but they're not trying to pay you how you're paid in the hospital. And do I think you should get paid how you get paid in the hospital? Not absolutely. You're not doing as much work, but you do need to be paid equivalent to what you're doing, and you can't be lowballed. So do not allow them to lowball you. Make sure you let them know how much you make at the hospital, how much another company is offering you, and also take into consideration your years of experience. Do I expect to be making $50, $60 doing home care an hour? No. But do I expect to make pretty close to what I make in the hospital? Yeah. I've been a nurse for how long? You gotta give me the money for the work. And they also have to consider this too. When you're in the home, in my personal cases, I don't have a tech, I don't have a CNA. Does it bother me? No, because one, I used to be a tech before, and two, I don't mind like cleaning the patient, getting them dressed, taking them to the bathroom, things like that. But I'm doing the work of a lot of people in one compact person, not only to save your company money, but also to save staffing. So they have to also consider that, and that's one thing you can also bring up to them if they do try to, you know, lowball you. Like, I gotta do work, I have to transfer patients by myself. I don't have somebody to help me lift the patient up in bed unless there's a parent or a family member home. I don't have somebody at home to help me transfer them from the bed to the chair, especially depending on their weight. So just take that all into consideration when you're thinking about home care versus hospital. Okay guys, now some people will ask me which I like better, and some people will ask me what do I feel like is my purpose. So I will tell you guys straightforward, I don't think I have a favorite when it comes to the two. Now if I go by purpose, you guys know, if you're been on my channel for a while, I do have a passion for kids. I love pediatrics home care, there's no question about it. If I could do it with the pay every week, all day, every day, would I quit the hospital? I thought about it a few times, but I like the hospital because there is a part of me that's addicted to the rush, addicted to the hustle and bustle, addicted to keeping my skills at a part where I'm always trying to level up. So I'm addicted to that in a way. But I also love home care to the death of me, and honestly, I will tell you guys straight up, if they paid me the same amount I made in the hospital, I would quit the hospital in 2 seconds and go to home care. And that's straight like that, because sometimes it's just not even worth your sanity. But anywho, thanks for watching my channel, guys. Thanks for tuning into this video. We talked about a lot of good things here today. Home care versus hospital setting nursing. What's the difference? What's the pros? What's the cons? What I like. If any of you guys do either one of them or do both, let me know how you guys compare them down in the description box below. I always say the description box. Down in the comment box below, let me know about your experience. Even starting off as a new grad, guys, people ask me sometimes, which one do you recommend? I always think you should start at the bedside, because you can take those bedside skills with you to home care. It's not like you can't take home care skills to bedside, but you learn that time management and that hustle bustle mindset when you're in the hospital or even in a long-term care facility, that when you get to home care, it's just like, okay. It's not saying that it's easier, but your mind is also more clinically trained. So like the first minute I see something going on with my patient at home care, I know it, and I'm calling the office and they're like, wow, how did you catch that? And mainly it's because I have experience to the point where I've seen this happen in patients in the hospital, and I know where it can get, so I know how to assess. Your assessment skills are sharp when you're in the hospital. Not saying they aren't in home care, but it's a little bit more lax to the point as you're in the hospital, you're seeing more patients, and you know how more situations pan out, so you know what to look for in other patients, if that makes any sense. So that was my little spiel for the outro. But anywho, guys, don't forget to subscribe, like, comment, and I will see you guys in our next upload. Thanks so much for tuning in.